Well, thank you everyone for joining us this afternoon. It's afternoon here in California for aligning funding opportunities and initiatives in California. And we're going to talk today about community schools funding. We have the great honor and opportunity to have Jose Vargas from the United Way Policy Manager here to take us through this funding and also help us really connect this to child abuse prevention. This webinar has been brought to you by Strategies Technical Assistance. Strategies Technical Assistance provides technical assistance to primary child abuse prevention planning teams throughout California, and also the Office of Child Abuse Prevention. I know we're probably all Zoom experts right now, but I wanted just to bring your attention to a few of the features that we will be using today. If you wanted to share your camera, you can always click on the little old school video camera icon they have here. If you wanted to, we will have opportunities for questions and answers. So the microphone, you can click to mute or unmute yourself. Right now, we're currently having everyone muted just because of background noise. We want to eliminate that. If you have any questions, concerns during the webinar or need technical assistance, you can use the chat function, which is the chat box. It says chat underneath it, and you can directly message myself. My name is Lydia Marquez. I'll introduce myself in just a minute, or our events coordinator on LinkedIn. If you wanted to react, this is really cool. Zoom just actually expanded this feature, but there's tons of different reactions. If there's something that resonates with you, you can use that as well. So we encourage that. So today, this is the Strategies TA team that will be here to facilitate and support this webinar. First, we have our amazing event coordinator, Anvi Din. My name is Lydia Marquez. I'm a Senior Technical Assistant Specialist, and I will be here to facilitate this webinar. And joining us today is our fearless leader, Sarah Lacqua, our co-director. So we will all be here to support you and also to learn alongside of you. And I wanted just to introduce our presenter, Jose Vargas, who's a policy manager at the United Way, we're so thankful for his time today to really give us a deeper understanding of community schools funding that will be coming in this year. So I'll let Jose introduce himself and hand it over to him. So thank you so much, Jose.
Thank you so much, Lydia. It's always a privilege when I'm able to, speak on behalf of, these really important things and programs to a wide variety of audiences. So always appreciative of that. Good afternoon, everyone. My name is Jose Vargas. I am the Education Policy Manager with United Ways of California. Before we get started, I kind of want to talk a little bit about why, this type of work is really important and personal to me. So I want to ground myself and why I really, do the work that I do and really have chosen this path for myself in working around education policy. So I'm the child of first-generation Mexican immigrants. My parents were both not able to complete their education. So my dad actually dropped out of school in 9th grade and my mother in 2nd. Now, while they both understood the importance of education, they had to financially provide for their family. So they both really always ingrained the importance of education in me and my siblings. Now, my mother always had, her ultimate dream of becoming a teacher in her small village and really helping her community. And although she wasn't able to accomplish her dream, I like to think that I carry her commitment to helping underprivileged communities through the work that I have the privilege of participating in me. So this is why education has always been really important to me and my family. So today we are going to be discussing community schools as a model and a strategy. So for those of you who were able to attend our previous webinar, we mainly focused on the grant features of the model. So requirements, expectations, things of that nature. Whereas today we'll be talking a little bit more about what actually makes a school a community school. So we'll go ahead and get started. Perfect. So unfortunately, my colleague Janice Canalin was not able to attend today, but I'll introduce her as if she was. So Janice is the Senior Health Policy Associate with the Children's Defense Fund of California, and has been working with myself on reintroducing Healthy Start for about the last 3.5 years. And of course, throughout this webinar, we are going to be talking about Healthy Start because that's really where we started in our work with community schools, and that of course gradually evolved into where we find ourselves today. So although our work did largely focus on reintroducing and modernizing Healthy Start, that eventually led the way for two bills that we worked on with Assemblymember Wicks and her amazing staff. So the policy framework that we introduced in those two bills ultimately were adopted by the legislature this summer to help guide the latest community school program. So that's just a little bit about our background, and we can go ahead and get started with an overview. So today we're going to be talking about three key things. First, we're going to go into community schools and really what they are, what they do, and why they matter. And then complementary to that, we're going to be talking about the four key pillars that makes a school a community school. And then lastly, of course, we're going to be talking about how to align funding opportunities and strategies that exist in our state, in our communities. And of course, last, we'll be going over some questions. So just as a really quick addition to that, the information and resources that I'm going to be talking about today come from the amazing work that the State Board of Education President, Dr. Linda Darling Hammond, and her work with leading experts on community schools, the Learning Policy Institute, have developed over the years. So I'll be sure to share the amazing wealth of research, information, and tools that they have established over the years, as well as these slides after today's presentation. So first, we're going to be defining what a community school is and rooting our conversation in why they're so important, why they're really needed in our state, in our communities. So with that, let's go ahead and talk about what they are. So before talking about what community schools do, let's talk about what a community school is, which is both a place and a strategy, right? So that's why you see two different definitions on the screen. First, we'll talk about the actual model. So a community school model is centered around the idea that a partnership between schools and communities is crucial to help meet the needs of students and families. Now, this is done by coordinating a variety of resources to support students and families on school grounds and in the community. Now, a community school is a school that utilizes that model, right? Now, the main difference between a community school model and the actual community school lies in the fact that community-based organizations can actually operate community school models. And of course, they're not necessarily schools, right? So a really good example of this would be the Children's Institute in Los Angeles. They are a community-based organization, and they help operate a network of community school models, right, that are schools, but they themselves aren't a school, right? So it's just a really small difference there. Now, regardless of whether a model is led by a school or a community-based organization, they must have four key pillars of what makes a community school a community school. And those are integrated support services, family and community engagement, collaborative leadership and practices for educators and administrators, and lastly, extended learning time and opportunities. So let's talk about what they do. Now, because each community school is a reflection of local needs, assets, and priorities, no two will look exactly the same. What they do share, however, is a commitment to partnership and to rethinking, and at times rebuilding, relationships based on a strong foundation of trust and respect. So school staff, under the leadership of the principal and the community schools director, work with families and community partners to create and implement a shared vision of students and school success. So in short, community schools acts as a academic and social center that stays open year-round, before and after school, and even on weekends, where educators, families, and neighbors come together to support learning and to address the impact of out-of-school factors, such as poverty, racism, and violence, which can undermine the effectiveness of in-school opportunities. Extending the school day and remaining open during the summer enables the school to offer additional learning opportunities and support, as well as co-curricular activities like sports and music, all of which are just as important as enrichment experiences that can help prevent summer learning loss. That is the widening of learning gaps that happen when school is not in session. So community schools engages families as learners and as partners themselves, offering the opportunity to develop skills such as learning English, coding, or preparing them for a GED or citizenship exam, and can support their efforts to improve the neighborhood. Now, a common theme that you'll hear over and over again during this presentation is just how important the role of the community and the students and families is in the pursuit of implementing these types of models. So now we'll talk about why these models are so important and why they matter. Now, full disclosure, this next slide is going to be extremely extensive and comprehensive, but it's really important to ground the work that we're trying to accomplish through these models. So California's education system has seen substantial policy shifts over the past decade with major implications and opportunities for our state's over 6 million students. Unfortunately, California still lags behind in many areas of meeting students' needs, which can be seen in disparities between students' health and academic outcomes. So academically, California has seen persistent gaps in student achievement among its diverse student body. Prior to the pandemic, California's African-American students and Latino students far underperformed their white and Asian peers. Further, low-income students, English learners, students with disabilities, foster youth, and unhoused youth also had worse outcomes on average than other students. All 5 of these student groups had relatively low test scores and graduation rates when compared to their peers. Now, there have been programs and resources aimed to helping these groups, but they haven't been as successful as they could have been. One of these examples would be the local control funding formula, which was supposed to provide more resources to students with the greatest needs. Districts with the most disadvantaged students, however, don't necessarily have more money. Some wealthier districts have high levels of local revenue in excess of their state aid entitlement. And we know entrenched segregation means that those places have fewer disadvantaged students. Further, the local control funding formula audit from 2019, which is the most recent audit, shows that hundreds of millions of dollars have been diverted away from the state's neediest students. Now, the challenges facing children and families at the local level in accessing supports cross child serving sectors, and the consequences of failure have been intergenerational, which we'll talk about later. Now, in terms of COVID-19, COVID-19 only compounded some of these failures. As distance learning became a reality for students and families virtually overnight, the pandemic really highlighted inequality in our state and our country. Prior to the pandemic, California ranked 43rd in Medicaid spending per student on school-based health and mental health services. This is extremely important as mental health and academic achievement are inextricably linked. Further, schools are a really important mental health system for many children and adolescents, providing mental health services to over 57% of adolescents who need care. Now, Medi-Cal, the state's Medicaid program, has also seen some failures of its own in terms of meeting the needs of students. Now, Medi-Cal covers about 5.3 million children in the state. However, 2.4 million children who were enrolled in Medi-Cal over the past 5 years have not received all of the preventative services that were entitled to them by the state. In fact, the utilization rate for preventative services for children enrolled in Medi-Cal has been below 50% for the past 5 fiscal years. Prevention and early intervention are critical to child well-being. However, California's current approach towards child safety and healthy development has been predominantly reactive, not preventative. And we can see that in the fact that fewer than 1 in 3 children receive timely developmental screenings, and 1 in 4 California kids under the age of 6 are moderate to high risk for developmental, behavioral, or social delays. So school closures were especially disruptive for children from lower income families who were disproportionately likely to receive mental health services exclusively from schools. So since most mental health disorders begin in childhood It's essential that any mental health issues be identified early and treated. Left untreated, they can lead to serious health and emotional problems. Now, historically, our child serving systems have faced a lack of cross-sector collaboration, a lack of transparency, a lack of data sharing and collection, and have persistently held singular target mindsets. Now, these issues make whole child approaches to care extremely difficult. For years, parents and others have highlighted the disconnections between school and mental health programs, services, systems, and professionals, and the negative impact of those disconnections have on children and families. Parents and family members have felt alone and frustrated when they try to navigate systems with diffused responsibility and little or no communication or coordination across schools and mental health providers. A variety of barriers have resulted in deterred successful linkages for years for families. Now, the systematic differences in behavioral health risk and outcomes between populations of children and their families are unavoidable and have been unfair and therefore have also been unjust. Community schools invest in what families and communities value and ensures that the voice of lived experience is not just identified, but heeded through policy change and systems reform. Child health is equitable and just when every child has a fair and intergenerational opportunity to attain their full health and developmental potential free from discrimination. With all the passion and expertise that is coalescing on early treatment and prevention, we must be collectively committed to systems change. And that system change must be rooted in equity. Equity is giving everyone whatever they need to succeed in life. The purpose of a community school is to invest on the front end of children's lives, helping them and their families and communities to thrive so that we're not investing in our failures to build strong families. And with that, we'll be talking about the 4 pillars of what really makes these models. Now, first, of course, we'll do a quick little review of what I talked about earlier in terms of what those pillars are. Now, of course, we know that a community school is a public school with strong and intentional community partnerships and ensuring pupil learning and whole child and family development. But they must include these 4 pillars: integrated support services, family community engagement, collaborative leadership and practices for educators and administrators, and lastly, extended learning time and opportunities. So first, we'll be discussing the integrated support services. Now, we're going to take a step back and talk about Healthy Start. Healthy Start really centered around a whole child approach to supporting students' academic and life success. It accomplished this by paying explicit attention to students' social and emotional development, as well as their academic learning, recognizing that they are intertwined and mutually reinforcing. Now, education is seen as one of the primary ways that individuals, regardless of their life circumstances, are able to succeed in life. But the reality is that a large number of students face significant challenges inside and outside of school that can impact their ability to do well academically. Healthy Start sites provided and coordinated a range of on-site services and supports to overcome both academic and non-academic barriers to students' educational and life success. Now, these programs also provided conflict resolution training, trauma-informed care, restorative practices to support mental health and lessen conflict, bullying, and punitive disciplinary actions such as suspensions. Now, in terms of community schools, the community school model takes this successful approach and builds upon it. First is the explicit role that students and families play in identifying their own needs. While this will sometimes happen organically in Healthy Start, in community schools, the role is more defined. Part of the reason for that is trying to avoid situations where schools, for example, might host community forums a few times a year or intermittently, and that is the extent of the role of families and students in identifying and resolving their own needs. Now, of course, not all schools do that, but this is just something that we want to avoid. In order to ensure transparency, accountability, and successful implementation, students and families must have an ongoing leadership role in their community schools. Now, critical to the community school model as well is the community school director. They serve as a member of the school leadership team. They help lead the analysis and identification of site needs and assets, and are responsible for developing, coordinating, and sustaining partnerships with service providers and organizing service delivery. Now, lastly, community school builds on the whole child approach lessons learned from Healthy Start by encouraging a continuum of care from birth to 12. Historically in California, children's needs have unfortunately been compartmentalized. Services for kids 0 to 5 is a different path for families seeking services than, for example, kids in traditional K through 12 settings. Now, in order to truly reflect a whole child, whole family approach, community schools now incorporates elements for kids 0 to 5 by incorporating these early childcare and education programs into the models going forward. And with that, we'll talk about some of the strategies for that integration. Now, first and most importantly is the role of community partners, parents, and students. First, counties, community-based organizations, non-governmental agencies, service providers, and other stakeholders help schools facilitate resource coordination and integration by convening state or local children's cabinets and councils that are composed of agencies who serve students. Right now, this is really important because it gets everyone at the table, and that is the first step to truly ensuring that the identification and the resolution of unmet needs is going to be met accurately and reflective of the community. Now, such cabinets can also help streamline the administration of state programs to avoid regulatory conflicts and duplication of efforts. And of course, it allows them to share and review existing resources. Now, next is really trying to ensure that we're going to avoid a cookie cutter approach. We don't want a top-down approach by requiring a systemic needs assessment process that includes input by students, families, and school staff. We don't want to be in a situation where we're telling communities what we think they need. We want them to lead that conversation. This assessment then guides the development of strategic partnerships for integrated student supports and direct services. Next is the technical assistance. So there must be funding for technical assistance and collaboration with and among schools and agencies. Now, the Department of Education, fortunately, has allocated over $160 million to develop 5 regional technical assistance centers to help with providing technical assistance to potential recipients and community school models. Later, we'll discuss some of the specific ways that these centers help with funding and services alignment and overlapping strategies. Ultimately, the organizational and operational infrastructure for providing integrated student supports should be aligned and developed across schools, districts, and of course, ultimately, the Department of Education. So they should be helping inform the best practices locally from the bottom all the way to the top to the Department of Education. Next, we'll talk about expanded and enriched learning time and opportunities, which is the second pillar of community schools and are just as essential to schools' capacity to support students' academic growth, as well as helping them develop socially, emotionally, and physically. Now, in addition to supporting rich student-focused instruction in classrooms, community schools provide students with as much as 1/3 more learning time in which they experience arts, physical activities, small group or individualized academic supports, and hands-on learning activities across a range of subject areas. Now, critical to that, of course, is partnering with community partners. Educators collaborate with community partners to provide well-structured learning activities during out-of-school time and summer using school facilities and other community spaces. Now, this approach makes clear that enriched learning time is the responsibility of both schools and communities. Programs, of course, will vary depending on community priorities. They can be things such as local partnerships with local businesses for internships, job shadowing, and other volunteer opportunities. Now, these partners should work in collaboration with the school's educators so that learning is connected and not just an addition, right? So this strategy allows for community schools to draw on the rich cultural and social resources in communities that are often absent from traditional schools. So it also increases the number of knowledgeable adults from whom students can learn. Again, something that disadvantaged families are able to routinely provide to their children. Now, these additional adults can support and mentor students, increasing their access to expertise and community role models. They also provide students with a greater chance to develop trusting relationships that foster meaningful learning and development and can offer additional support that responds to students' needs. So why is expanded learning time and opportunities so important? Well, Those who live in more affluent communities have access to academic support and enrichment beyond the school day and year, including tutoring, uh, additional learning opportunities, such as science and computer coding camps, for example, sports, music, and art. Now, consequently, these students have more learning time and more opportunities to succeed in life. Now, these advantages aren't accessible to all students. Due to uneven distributions of both public and private resources, families living in low-income communities generally lack access to these rich supplementary learning opportunities. Now, these differences in learning opportunities widen the achievement gaps between young people from high and low income households. Rich opportunities to learn can increase academic and beyond academic outcomes, including improved student attendance, behavior, achievement, high graduation rates, development of social, emotional, and leadership skills, and of course, reduced involvement in juvenile crime. And believe it or not, it actually really helps families as well with the interaction amongst themselves. Something that we saw with Healthy Start was just how much it could improve relationships among a family. Now, although the first real major study for ACEs wasn't really conducted until after Healthy Start started, we saw that some of those um, instances where children experience adverse childhood experiences, all those traumas from racism, violence in their community, abuse, with time with these types of model decreased significantly. Now, another compelling reason is that this approach supports curricula and instruction that leads to deeper understanding and fosters a sustained school improvement. Now, this is especially important in schools where testing and accountability pressures have reduced or in some cases eliminated students' access to a broad array of content, social studies, science, art, music, and physical education. When teachers and community partners collaborate to plan and provide access to a broader curriculum, students have the opportunity to pursue non-tested content, which is just as important. And in terms of some of those strategies for expanded learning time and opportunities, first, we really want to ensure that there's going to be a focus of additional time on student learning. So that's to broadly conceive to include academic, social, creative, and emotional development. Align activities with schools' learning goals. Aim expanded programming at strengthening curriculum and instruction during the regular school day, as well as providing additional enrichment and support. Effective programs aren't just about safety and supervision before and after school, but also about what those needs are specifically. Now, we must ensure that there is sufficient additional time, right? So for students to receive the greatest benefit, policies lengthening school days and or years should at least focus on a 1/4 increase over existing time. Out of school time programs, including after school and summer school offerings, must provide additional time to accommodate both academic and enrichment activities, not just one or the other. So this is equating the importance of both. Now, we want to talk about supporting community collaboratives. We must support partnerships with community organizations, public agencies, and employers who can provide additional staffing and augment some of the resources and services. These include expanding the spaces in which students can learn, as well as increasing the number of adults with whom they are learning and the content of what is being learned. Must include teachers, non-teaching staff, the professional organizations, community-based organizations, and community members as key partners in designing and implementing plans that lengthen the school day or year in terms of changing staff arrangements. Now, oh, sorry, having some trouble with, there we go. Okay, and of course, we want to identify and remove barriers. We have to remove unnecessary barriers to facility sharing, for example, between school systems and community-based organizations. And that's going to be really critical into how we accomplish active family and community engagement in schools. So as I said before, and many times, families, students, and communities should be at the center of the implementation of these types of models. These types of engagement are essential to fostering relationships of trust and respect, building the capacity of all stakeholders and the school when creating empowered decision-making processes and educational inequities. Community schools prioritize meaningful and ongoing engagement of families and community members and establish the systems, the structures, and the supports to make it happen. Educators and other staff at community schools understand that engagement happens on a continuum, from partnering with parents to developing and promoting a vision for student success to offering courses, activities, and services and opportunities for shared leadership. Families and community members, for their part, feel welcome, supported, and valued as essential partners. Now, critical to understanding is partnering with families and community members on the front end of community school models implementation process is really critical to developing the full understanding of the strengths and challenges of the community, and determining the appropriate mix of services, supports, and opportunities that are needed in those respective communities. For example, when families and community members participate in the assessment of needs and assets, they provide insight into the root causes of issues facing the community, but are also invested in the shared vision created for school and student success. Now, of course, it also helps in addressing historical challenges. So school-based strategies to engage families and communities in low-income neighborhoods should be informed by historical challenges to meaningful involvement. These challenges include administrators and educators who've often not made schools welcoming places for families from diverse backgrounds or offered programs that support and address diverse cultural backgrounds. In addition, families in low-income areas often deal with other impediments to full participation in school life, such as language barrier, inflexible work schedules, and a reliance on public transportation. Collaboration can be meaningful. Collaboration doesn't guarantee agreement, but it can help draw out and create dialogue between existing partners or existing tensions. It's through collaboration that stakeholders can build the trust and respect that is needed to make lasting change, those large change that these communities have identified and are seeking. Community schools helps address these and other challenges by streamlining the access to services, making schools safe and a welcoming space for all families and community members, and scheduling programs, courses, and meeting times that allow for the broadest participation. And we'll talk about some of those strategies to assist with that type of engagement. So of course, the first centers around the continuum of family and community engagement. There needs to be structures and practices in schools that support a continuum of family and community engagement practices, such as helping parents in supporting the needs of students, classes for families and community members, volunteer opportunities, the inclusion of on-school leadership teams, the leadership coaching to support their full participation. Families and community members are engaged in all steps of these types of models, in the assessment, in the planning, in the implementation, and the evaluation of the community schools strategy. And of course, engagement opportunities for educators and school staff. Teachers and school staff should have opportunities to value and learn from the experiences of parents and communities, seeing them as having funds of knowledge that can inform classroom practices and curriculum, making them more relevant to students' cultural backgrounds and expertise. This in turn will foster stronger relationships with parents and families. School staff and leaders have opportunities to develop their capacity to build trusting, collaborative relationships with families and community members, recognize class and cultural backgrounds as having important assets for the school, and share power and responsibility. District leadership and facilitation support schools as they implement programs and reach out to families and community members. And next, we'll go over the final pillar, which is that collaborative leadership and how to ensure that there are practices to support that. This is what binds and reinforces the other three pillars. Collaborative leadership and practices essentially is really the relational glue that connects and reinforces the other pillars by making it foundational and critical for the success of a community school strategy. By developing a shared vision and goals and creating participatory practices for distributing responsibilities, a community school can leverage the collective expertise of all of its stakeholders. In many schools, collaborative leadership and practices are central to the work of the professionals in the building: teachers, administrators, non-teaching staff, and union leaders. Examples of this include professional learning communities, site-based teams charged with improving school policy and classroom teaching and learning, labor management collaborations, and teacher development strategies such as peer assistance and review. In community schools, collaboration and opportunities for shared leadership extend beyond staff to students, families, community members, and leaders of community-based organizations, local government agencies, and even university partners. These expanded collaborations can take a range of forms, including school governance and program planning, such as responsibility for assessing school context and needs, resource distribution, and continuous improvement. Secondly, the coordination of resources and supports. And lastly, the practices and systems to maintain constructive relationships between school staff and the members of the community. And of course, essential to that is also district level support. Collaboration at the district level is essential to the successful implementation, especially in medium to large scale community school initiatives. Collaboration with families, community members, and local organizations in planning, implementation, and monitoring of initiatives pays big dividends. It improves district coordination of services and programs to best meet the needs of stakeholders, helps align community-wide goals and measures of success, and of course, fosters strong and supportive relationships with partner organization. Collaborative leadership ensures inclusive implementation. It creates shared ownership of the work and is tailored to address local needs based on local assets. With increased leadership among family and community members, schools are better able to serve as centers of community where everyone belongs, everyone works together, and our students succeed. And next, we'll talk about some of those strategies and why they matter. Now, again, this is the glue of all the other pillars. And that's because this helps improve not just students individually, but school and community climate. It's all about strengthening relationships and building that trust and a sense of collective capacity. Trusting relationships support school transformation by helping create nurturing and respectful environments in which caring adults, community members, and students see each other as united in working towards student success. The trusting and supportive relationships built through collaborative practices also extend beyond the school site and contribute to the health and safety of the broader community. As educators and other school staff work with community members and families, they can make sure that additional services and programs they provide are relevant and responsive to the needs and cultural practices of the community. Students and families, for their part, are more likely to access available resources when they have been a part of the local needs and resource and assets mapping. And practically speaking, collaboration provides the additional human resources that schools require to offer this expanded range of activities and resources. Importantly, collaborative practices also extend leadership and power beyond site administrators to include teachers, to include school staff, parents, and community partners. By being more inclusive, these practices both improve the quality of the decisions being made and help prevent an unhealthy dynamic in which educators and other professionals see themselves as in charge of delivering services to families and communities, rather than as partners in creating a thriving school community and addressing social inequalities. Finally, collaboration can build community support for public education, including the ongoing investments that are critical to sustaining and expanding a community schools initiative. So I'm going to give a quick example of how you can use these pillars to establish a model. Now, of course, there are many variations of this, right? As I said earlier, no two community schools will look exactly the same, but they all have those four critical pillars. So on this slide and the next, I'm going to be going over how one can implement the four pillars. Now, we can envision these as living through 6 key processes: establishing collaboratives, assessing community needs, prioritizing and composing strategies, integrating and improving delivery systems, and reassessing and reforming the community school model. So first is establishing collaboratives. Schools can use the community schools grant funding to create or continue dialogue between community partners, unions, cities, counties, and other partners to ensure effective collaboration, strategic planning, systemic reform, and community building. This will ensure that efforts will be far greater in unison rather than if they were to be siloed. Um, Specifically, these collaboratives will come together to determine what activities and resources will look like, what positions will be needed, and how they will be paid for or utilized or reassessed, reformed, removed. Community school partnerships will focus on family and community involvement in the design and deployment of solutions rather than on deficits and remedial treatments. So of course, critical to the implementation first is going to be the assessment of community needs. Local need and circumstance should determine the partnership of those compositions, of those partnerships. These partnerships will come together to develop a picture of the community and map out existing resources and issues. Once these needs are identified, collaboratives will strategically discuss whether important information is missing and what resource or services will be most helpful. This will paint a clearer picture of their communities and help more accurately identify pitfalls in existing systems and what reforms will be needed. Partners will then introspectively analyze and increase their resource commitment. The center of activity for most community school sites is some type of permanent center, family resource center, if you will, at or near the school site. It is an absolute priority to capture the voice of the community and find ways to bring the community into the local governance and leadership at the center. Next is the prioritization and composition of strategies. The community needs assessment will be used to determine what services warrant prioritization for families, schools, agencies, children, and communities as a whole. Further, it will help promote discussions on whether and how policies in existing systems need to change support strategy. For example, aligning program goals, integrating duplicative functions, eliminating fragmentation, or increasing flexibility and responsiveness. So once the best strategies are identified and chosen to achieve the desired outcomes, schools will draw on the capacities of all partners to their areas of expertise. And on this next slide, we'll cover the two final processes. So next is going to be integrating and improving those delivery systems. Grantees, together with their partners, will decide how to integrate and coordinate activities of all partners at the established site. For example, establishing intake systems, managing activities, information sharing, all of these good things. Now, this, of course, will in part be led by the identified community school director. Identified decisions will be made as to how students and families will be involved and have access to supports. For example, broad activities, supports aimed at specific outcomes, case managed services, and help in times of services. Lastly, schools will determine how they track their progress and outcomes. Individual students and families, aggregate data, impact on system caseload, things of that nature. And then ultimately, there's going to be a final step in terms of reassessing and reforming the model. So a very crucial part of any successful community school is the idea that it is a living, constantly evolving model. Targeted outcomes that were outlined in the planning and implementation phases, which of course includes students and families at the center, should be reviewed and reflected upon. If targets are unmet, partners, communities, families, students, and educators should get together and discuss areas of growth and opportunities and reflect that in the model. Now, in terms of implementing the pillars, I know I sound like a broken record, but at the center of the community schools model is the acknowledgement that they're not going to be the same because community needs are unique to the respective communities that are doing the identification. We don't want a cookie cutter approach. We don't want every model to look the same because they shouldn't. Now, while each community school collaborative will be unique to a community's needs, we envision each to be designed to do the following. So first, ensuring that each child receives the physical, mental, emotional, and intellectual supports they need in school through distance learning and telehealth, at home, in the community, to succeed in school and in life. Next, build the capacity of students and parents to not just be participants, but leaders and decision makers in the models and in their communities. They must support child and family serving public and nonprofit organizations to streamline and integrate their programs to provide more effective prevention and early intervention for support for children and families, particularly those from 0 to 5, to really ensuring that there's going to be a continuum of care and continuity in these models. And of course, investing and building community, family, and individual resilience or providing timely access to services so that children and families have all the resources they need to be successful. And now we'll move on to how we can best align funding opportunities and strategies. So this past year, there have been historic levels of funding for so many programs across the board. The historic investment in community schools does mark a transformative moment in how the state of California makes good on its promise of whole child-centered quality education. This marks the beginning of a movement to systematically integrate schools, healthcare, and social services across California schools with a clear and intentional focus on equity for children and families. Now, there were a number of notable pieces of legislation and budget investments that also passed this year that, if properly braided with the community schools program, can help reimagine our education system to truly address educational inequities in their roots. And these are just some of the examples. A really big one is the Youth Behavioral Health Initiative, almost $4.5 billion in funding to transform the state's the behavioral health system, which of course the overarching goal of this program is to better connect children and youth to behavioral health through the creation of an online platform, through investment in school-based services, and expanding the infrastructure for providing behavioral health care. Now, this, of course, also includes 400 million in Medi-Cal managed care incentive program to increase school-based health services specifically, and 550 million to assist with additional schooling behavioral health partnerships. Next is the broadband for all investments. I think something that we all really were able to acknowledge and be supportive these last 2.5 years was the role that technology played, not just in terms of education, but health, really ensuring that telehealth is going to continue to be an option for our students and families. And then, of course, the investment in the Universal Transitional Kindergarten Program, which will be gradually phased in over the next 5 years until it includes all of the state's 4-year-olds by 2025, 2026. Again, really trying to leverage this and ensuring that there's going to be a continuity, really ensuring that the needs are going to be met for all of our students, from our youngest to our older students. And of course, the enormous investment in expanded learning, and something that I'm really excited for, it was the establishment of the Office of School-Based Health. This is something that has been in the works for many years. This is going to really be a pivotal program in the future of community schools. Now, this is one of the most significant steps taken by the state to break down barriers and silos across entire service sectors, as Healthy Start originally sought to do, while targeting our most vulnerable students and communities first. Now, while this funding will be prioritized for districts and schools with the highest levels of poverty in terms of the community schools funding, we envision a future where every school will have the opportunity to become a community school. So now we'll talk about some of the existing funding streams. Now, historically, funding streams have been very siloed and complex. This is something that we really recognized with Healthy Start. Now, this is only a snapshot of the few education and health funding streams. It's hard to fathom and even harder to coordinate at the local level without support and leadership to do so. But these are so many different good services and programs and streams that should be leveraged, right? But we know in a lot of communities, there simply isn't the capacity or the structure in place to help take advantage and utilize all these different types of services and programs. So we'll talk about how community schools will help in that on this next slide here. Now, it's not a straight path. We know that. It's been many years since many of these funding streams have been introduced and modified. So we do know that, but we know it can be done, right? And we know that because community schools and Healthy Start have showed us how to start and how to succeed. And of course, that all starts with the local collaboratives. That's why these funding opportunities are really important, because it gets everyone at the table having those discussions, having those hard discussions of the persistent problems that communities have been facing and how to best address those together, being in the same room with having these conversations and trying, instead of trying to accomplish some of these goals in very individualized manners. So let's talk about some alignment strategies. So taking on the challenge of establishing a community school scares many people, but it shouldn't. Community school seeks to leverage the wealth of knowledge, relationships, and resources that exist in communities. And in those instances where they don't exist, leveraging the state and communities' help to begin that process. Now, back when Healthy Start first started, there were very few programs and services that communities could have leveraged. We now find ourselves in a position of having almost too many to choose from, which can be as equally intimidating. Now, the greatest challenge is, of course, the development and alignment of the plethora of tools and resources that exist at the state level and the community level. There are so many existing programs, strategies, and structures in place that can be leveraged. That's why community leadership is so vital to the community school model. Community school grants aren't designed to pay for supports and services that other partners are already charged to provide. Rather, it's to integrate these supports in new ways that lead to innovative and improved results. Now, something really exciting is, as I mentioned earlier, the State Department of Education is going to be establishing 5 regional technical assistance centers throughout the state to help with the technical assistance for these models. Now, their responsibilities will range, but of course, it's going to be centered on developing the resources, best practices, and data collections on how to best implement these programs. We want to ensure that the best practices that we're learning in our diverse community in our state are going to be taken to the state level and implemented to truly break down the silos that exist systematically. And with that, I can give the latest community school updates in terms of the program itself. Now, the Department of Education has begun its process of community engagement that will span from this month through the end of January. The first of the series of engagements will be 6 regional virtual community forums to be held over the next 2 weeks, which is included in the slide. Now, they're designed to be an initial step for the department to hear community voices throughout the state. So I would highly encourage you all to attend that. And I will be taking the contact information of all of those who are interested in attending so that you can have your feedback and your input included into these forums. Now, of course, feel free to share this with your local partners in your organizations, your school community members, students, families, school staff, partners you work with, and any school or community groups. We want to ensure that this process is going to be inclusive as possible and include the voices of the communities who are going to be impacted directly by these programs. And with that, I will take a pause and see if there are any questions. I really wanted to ensure that I left enough time for questions, just because both the grant application itself for community schools and the models are just 2 really complex systems on their own. So together, there's a lot to take in and to digest. So I am going to make myself available to answer any and all questions that you have from either the grant program itself or the model.
So there's a couple ways we can do this. And one is, if you wanted to put your question in the chat, I can read it for Jose and he can answer. And this is Lydia. I did not turn into a cat, but my internet is unstable. So I had to shut off my camera. And if you wanted to ask the question yourself and be unmuted, just raise your hand and we can help do that. Or I think you should be able to unmute yourself, but we can call on you if we have a lot of folks that want to ask questions. So feel free to raise your hand. We'll call your name and you can unmute yourself. So Either way, whatever you feel comfortable doing. While we're waiting for folks to kind of formalize the questions, Jose, I just wanted to kind of share with you. I previously worked for a private free school called the Primary School in East Palo Alto, and they very much have like a community school model. It's still, I think, developing, but basically the school accepts families from prenatal to 8th grade. So early intervention and parent support, what we call two generational support, was part of the program. And then they partnered with a local health clinic that served a lot of families in the community, as well as Kaiser and a couple of other well-known providers in the area. Their ultimate goal, I think they're still kind of working with the city. There's lots of politics involved in terms of building their actual site, but the site will have a health clinic. It will have a place for a family resource center and some community-based organizations there as well. So basically what they're envisioning is this one-stop sort of place for families. And their big dream is to provide low-income housing on the campus as well, so that families are able to, not only, have access to housing there, but also, the school community is a gathering place for folks. So there's this social component of building a real community, and also the supports that they need to thrive. So I would recommend, I can put the website in there just to check it out. It's still developing, it's still evolving, but I think that what you've described in community schools, that's just an example. Their funding is private, so of course it's a little bit different, but I think it can give you some good examples for those that are working on that in their local communities. So it looks like we have a hand up. So let me for Najib. So go ahead and ask your question. I don't know if you need to be unmuted or you can do it.
Thank you. Can you hear me?
Yes, thank you. Go ahead.
Perfect. Yeah, Najib Camille from Santa Cruz County Child Welfare. Really informative, presentation, and just thinking about it in the context of child abuse prevention, because that's the kind of the area that I'm kind of working on. I've got a number of questions, so you can take them how you will, and I don't know if there might be some additional follow-up. But number one, you did mention earlier in your presentation that you have like all the research and studies that you could share with us. So I'd be really interested in seeing any research about existing community schools and how they work and how they get funded. And then the other piece, which kind of was alluded to by Lydia in her kind of talking about the Palo Alto school, is like, it seems like there's going to be a need for actually building space. I'm thinking if we're looking at a community school to have these various services there at any given time during the day, that would be a part of the funding and the work that needs to happen. So just kind of want to hear your thoughts on that. And then lastly, I think just the way these kind of initiatives work or have been working is that we're seeing funding coming from many different sources, many different departments at the state level, and just thinking, how do we're already overstretched in a lot of like specific types of services like mental health or social services, benefits. How do we, add another kind of layer to providing services at a site with the existing resources? So I didn't necessarily see that part about, I saw kind of like some funding that was specific to community schools or related to it, but just kind of thinking about how do we provide services when we don't have necessarily the capacity or the funding to increase the resources.
Oh, there we go. Okay. So I will do my best to answer that. I think it really falls under two different types of answers, right? So I think the first one is relative to the regional technical assistance centers that the state really is establishing to really help answer some of those very specific questions, right? And the second being what that answer looks like locally, right? So I think in terms of this specific funding, right, it is to increase that capacity, right? It is to establish that backbone to one, have those conversations of identifying, those problems or potential solutions, but really ensuring that that backbone is going to exist so that then that school, that specific site can reach out to the technical assistance centers and receive assistance from them on those specific types of issues, right? So something that's probably more important than ever with this iteration of community schools is the role that these technical assistance centers are going to play. So what we saw with Healthy Start, right, is a lot of these similar questions of, well, how are we going to address X or Y, or, we lack, A or B. Now with Healthy Start, unfortunately, they were kind of left to their own devices locally, right? Because there was no real state structure to kind of help assist with that. It was just you receive the funding and you try to do the best that you can with that in your local community. Now, with this iteration of community schools, the goal, the vision, if you will, for these regional technical assistance centers is to think out some of those issues locally so that you can receive that help locally and address that to the best ability possible. But more importantly, is trying to identify some of those issues and whether they're systematic, right? So I think ultimately we want to break down these problems, right? These silos, these systematic issues, and crucial to doing that is really ensuring those instances are going to be identified locally. So I think it's going to be a very feedback driven process. It's going to be difficult because it'll take some time to get these regional technical assistance centers up and running. But I think that's why they're more important now than ever, because that input, that feedback is going to be important in addressing those types of issues, not just locally in one or two communities, but across the state. It might be an issue where that's really common and we don't even know because we're not sitting in the same room and discussing this all the way from Northern California to Southern California, or if it is something right that is statewide, really ensuring that there's going to be conversation not just amongst the education sphere, right, but we really want to ensure that there's going to be cross-departmental collaboration, right? So if it is health related, mental health related, behavioral health related, right, we want to ensure that there's going to be a dialogue, not just in that local community between, let's say, the mental health department and the school and other partners, but really ensuring that there's going to be this dialogue at the state, right? We want the Department of Education to communicate with the Department of Healthcare Services, social services, other departments, because we know that even if it is discussed and identified and resolved locally, it's something that should be occurring at the state level as well, because unless it is, then those problems are going to persist, not just locally, but statewide, right? And that's why this is still in part. Now, they're still being identified by the Department of Education, but the hope is to have those regional technical assistance centers really encompass a vast net of providers and stakeholders and organizations, really, right? We don't just want it to be a case where it's for example, a community school that operates the program extremely successfully, right? But we really want to ensure that the reason behind those successes, right, those communities are going to be able to sit at that table and help resolve and identify these issues, right? Because I think it's not just necessarily about, trying to quote unquote replicate success, but really ensuring that you're going to be talking about those very early on preliminary discussions of, well, what obstacles were removed, right? What obstacles were identified so that that success could be had. So that, I don't know if that really answers your question, just because those centers haven't been selected yet, but the aim, the hope, right, is for those centers to play a really important part in addressing those concerns, both locally and statewide.
All right. Do we have any other questions? There was someone who.
There's a question in the chat from Petra. So she says, you called out in your slides providing interventions, particularly for 0 to 5. However, most of the presentation referenced the K-12 system and structure. I'd love to see more strategies and best practices for assuring a focus on 0 to 5 in the community schools design. I guess more of some feedback. Thanks, Petra.
Right. Absolutely. Good point. Now, this is one of those situations where this is new to the community school space, right? So just going back a little bit historically, something that we saw with Healthy Start and the programs that really remained decades after that initial funding, ultimately was finished, was that those programs who remained really had a lot of relationships and programs and services directed to not just our traditional students in K through 12, but the earlier years, right? Which of course we all know is really important because those are the key developmental phases in a child's life. So when we were first thinking about the framework for the policy behind community schools, we really wanted to encompass those elements in the works going on, right? Now we weren't prescriptive in the policy for one main reason, right? And that was to ensure that there was going to be flexibility in how applicants and recipients ultimately chose to pursue their own respective community school models, right? Now, the Department of Education is having discussions with folks in the ECE space to take that into consideration and really start building that out, right? So it is an ongoing process. So it isn't at least explicitly established yet, right? But the hope is to continue having these conversations, not just in communities in general, but also having specific conversations with folks who are going to pay or play a crucial part in the establishment of the program, right? So having specific conversations with the experts and the folks in the ECA space to talk about what some of those practices and interventions are going to look like, right? I think personally, I think in the future, we really want to see a focus, or not a focus, but a real explicit inclusion of the Surgeon General in her office and her work around adverse childhood experiences. I think it's something that we saw with the original Healthy Start as well. As I mentioned earlier, the first real study on ACEs didn't really conclude until Healthy Start was already an active program. But what we saw is that Healthy Start was really successful in addressing some of those root causes of adverse childhood experiences, right? Of violence in the family, in the home, to community violence. And we know, right, when you address some of the stressors that occur in a family's life, whether they be related to finances, or housing instability or food instability, that plays a large part in how relationships are established in families, right? Now, on the negative side, right, we'll see that that type of toxic stress can lead to things such as violence and abuse, but if properly addressed, right, especially early on, we know that they can develop positive relationships within their family and responses to stress in general, so that it doesn't have a long-term impact on not just the family, but of course, the students and the children in the long-term pursuit of their education and their success socially, emotionally, and physically. So those specific strategies are still being developed.
I think there's a lot of opportunity, there for that early childhood space. And, I've seen, for example, family resource centers that are providing, mommy and me class, or, a music and me class where it's the FRC is on a school campus. So we have families who have children that are school age, they drop their children off, and then they're able to take their younger child to this, interactive, parent education program. So that's not an intentional community school model, but it could be an opportunity to make that connection. So I think it's a good idea to just explore like what's in your community that could actually be part of this, or how could there be opportunities for connection there. So I think that that's just something to consider, is, where can we find those opportunities, and maybe, share some of the programming that you're doing in first five and figure out where can we make that connection. So I think that would be something to explore.
And then really quickly, going back to the question that was brought up on facilities, I think there are a couple of different ways that can be approached, right? I think, what some schools have done, right, is to take advantage of existing facilities, whether that means, transforming a certain area or just creating one altogether. Sorry, dogs are barking. Or they can work with the district, right? Sometimes the district will ensure that they allocate specific funding for that specifically, or utilize some of the funding from the grant program itself, or of course, relying on the community, in which case they, help establish together, right, this community sphere, this community center, which of course can, lie and exist within the community or on the school specifically, and really leverage that as best as they can, right? And there's some instances where, they start in the community, a community center, and then eventually they kind of integrate it onto the school, right? Or they'll end up having two different kind of campuses, if you will. So there's a different couple of ways that can be approached. But I think first and foremost, right, is trying to take advantage of the partnerships that are going to be working on it with the district, community partners, and then having that discussion of, well, is there something that exists in the community now that we can use to, house this in, right? Do we ultimately see this living on the school, and how is that going to look like, 1 year, 2 year, 3 years from now?
I have a wonder, Jose, I think there were the listening sessions you just mentioned. It looks like a lot of them are happening next week for different regions throughout the state. If folks wanted to, would you say that those would be good places for folks to advocate for, example, like Petra's mentioning, right? Like 0 to 5 being really more heavily considered. Like, are those the spaces in your experience to do that?
Absolutely. So there's actually kind of two big opportunities, right? So, this first opportunity is really region specific. And this is going to be more of like identifying specific problems or questions, concerns that folks in these regions are, having in terms of the grant program itself, or, raise questions of capacity, which is actually something that's, really common that I know we've heard of multiple times. And then there's going to be this second opportunity where it's getting really down to the specific strategies, right? So it's going to be taking what is, discussed in these community forums, and then starting to talk about, all right, well, what are some of the ways in which we can address some of these issues, whether those issues can be addressed, in the near future, or something that, the regional technical assistance centers are going to have to work on in ongoing fashion. So absolutely, if you can, absolutely attend these community forums. I will be sure to forward everyone's contact information that is interested in those. But I think these are absolutely the most important types of engagements that you can have to really ensure that whatever feedback you have, whatever questions you have, is going to be definitely addressed by folks who are working on this, by the department itself.
Yeah, it looks like for Central Coast and Central Valley, right? Central Valley's is tomorrow. Central Coast is next week. So thanks, Lydia, for bringing that slide back up. So sounds like that's a really critical piece for folks to get involved with right now.
And if you wanted to get more information, please put your email in our chat, and we'll go ahead and forward those off to Jose so that he can give you the information.
I had another question. If there's no more questions from the group here, please put them in the chat or feel free to raise your hand. But Jose, I don't know if this was covered, but how much is available in this funding throughout the state, and how many sites is DOE looking to fund, from what you know?
So there's $2.8 billion for the entire program. The amounts will range. I believe, if I still know how to do math right, that the maximum awardable amount can be upwards of $2.5–3 million. And I don't want to get too specific in terms of how that works, because it can get confusing. But essentially, most of that funding that is going to be received annually comes from the implementation grant, and the maximum amount for that is about $2–2.5 million per site. Now, it's also going to depend on the composition of your partnerships, right? So whether you apply to as a consortium of multiple schools, right? Um, there's going to be other considerations that need to be taken into account when developing grant amounts of readiness, right? So if folks are in a position where they're more readily available to begin implementation, they might receive funds differently, right, than those who might need the full 2 years for the planning phase. Now, and that's not to say that they're going to be punished, right? They're actually going to receive probably a little bit more help in terms of the amount to plan to really ensure that that blueprint is really going to be there for when they are ready to apply for and receive implementation grants. But they're essentially broken up into 3 different phases, right? So the planning phase to really build out that capacity to do needs assessment, begin those conversations in the community. And then the second is, of course, the implementation grant, which is once that applicant is ready, then they can apply for and receive the implementation grant to build out the infrastructure to really take the blueprint and manifest it. And then the last grant is the coordination grant, which is just a supplemental to ensure that there's going to be a little bit more funding to help with implementation, but of course with evaluation, data collection, things of that nature, and just really continuing to build out the capacity for that model.
Great, thank you. I'll ask, since I'm already off mute, where should folks go if they want to keep informed on this funding? And like, where's the best place? Is it through DOE, through United Way?
Yes, the Department of Education's website. So they don't have the specific information on the grant, again, because it's still an ongoing process, but they will have all kind of major updates in terms of their community forums or whatever updates they might have on their website. I can also share out 2 documents that the Department of Education has shared, one in terms of timelines for the program, and then the second document would be the more general information about the program and how they're really envisioning it existing. And those were officially approved by the State Board of Education last month. So it is essentially, the real first step, the first like formal documents that can be shared with the community, and they're kind of finalize what they're trying to accomplish.
That's great. Thank you so much. Any more questions from folks? All right. If nothing else, Lydia, do you want to take us through the last couple pieces?
Yes, sorry, my unmute was not working. So I guess the universe was telling me to be quiet. So here is the contact information for Jose and Janice, who are both working on this project. And again, Jose, I just want to thank you so much for joining us today. And I know that I've learned so much about community schools funding. It's such an innovative project and a great way to really collaborate to support families. And I think it's in a way that we may not have thought of before. So I really appreciate your time and your knowledge that you shared today.
Well, thank you for having me. I think I'm more appreciative of you all and the work that you do. And I think it's just a matter of trying to uplift all that good stuff. And really ensuring that the Department of Education is going to be taking advantage of that as they, are really thinking out the implementation of this program. So, thank you all for all that you do, and I will continue to, share whatever information is shared with me and relay it to you all.
Great, thank you. So as we close out, first of all, I just want to thank you all for your time this afternoon. I wanted to bring your attention to a couple of things. One is, please look out for a follow-up email from us. It will have the link to this recording on our YouTube channel, as well as a SurveyMonkey. We actually put that in the chat. So if you have the time right now to fill that out to let us know how this webinar was. If you are not able to do it at this moment, just know that we will send that out. We also wanted to bring your attention to the learning exchange that will be held December 7th, which is just next week. And that will be an opportunity to touch base again with Jose, be able to kind of go deeper with some of more, more specific questions about how to connect with this funding, and as well as being able to really kind of share what you've learned about your own areas, your own counties, and the work that they're doing around community schools. So I think that would be a good thing to explore if you have a chance before next week, is, try to find out, well, what model is your county using? How can you get connected to that? Also, I just wanted to remind everyone, we have Facebook, LinkedIn, and we have a YouTube. So please follow us for more information on our upcoming events. And also subscribe to our newsletter, because we are always sharing resources, information, and of course the events that we do. So again, thank you so much. Have a great afternoon, and stay safe and healthy. And we will see you all hopefully at the Learning Exchange next week. Take care.